metastasis in breast cancer, recurrence or widespread. Normally, what the normal school medicine has to offer is another chemo, another chemo, another chemo, with more and more side effects, sometimes with so-called antibodies, which have also serious side effects, with another radiation, and another radiation, and some operation, and that's it. And then at least the best supportive care. I'm looking here in Germany also after a hospice, and we find it more or less regularly, if patients are just treated from the books, that they get their last chemotherapy or their last blood transfusion, they are put in the ambulance and they are driven to us. And that's not the way I would like to be treated. I would like to have my wife to be treated. That means whatever I can do, even if I'm far advanced in disease, I definitely have to try to boost in any way my quality of life, and the better the quality of life is, the longer I live. Definitely. That's proven, and that's unquestionable. And if I'm try to cut down on risk factors, if I have a big mass of tumors in different organ systems, that's ideal situation where I can do a lot of good with anti-inflammatories, for example, boswellia or special enzymes, with antioxidants, and then definitely cell therapy. Because there, if I have the surroundings, if I have the environment cut down on the tumor growth by antioxidants, anti-inflammatory, then the activity of the cells and for the cell extracts and for the growth factors are ideal, so they can come in and help activate repair genes. And as long as I live, I have repair genes, and I have, even if they are sleeping, if they are dormant, I can shake them up. I can activate even my immune system. I can activate natural killer cells, T cells, B cells. I can do that, and that is cutting down on numbers, and it's boosting my quality. That's no doubt about it, and we see it here every day. We have between 100 and 200 patients coming in, going out every day in our clinic. We would long be gone. We are here for 25 years now. We wouldn't be here if we wouldn't have the success. Our patients come actually from all over the world. And it's mouse spread. Here in Germany, we have not the possibility to advertise. We wouldn't do that. It's not my business to advertise. But if a patient gets better or gets well, then he's spreading the news, and so other people come. And you have to be fair. You have to listen to the person who comes, what the person wants, where he stands, or where she stands, and then talk about the possibilities of treatment. And then step by step, if the patient is educated enough, you have to educate him that he knows what's going on with his body. A lot of the school medicine is treating or is handling with anger or with fear. And that's the worst part, that's the worst side effect you can have in a normal conventional treatment. Because a lot of people come here and say, I don't know what happened with me, but I'm going down the drain. The first thing in getting better is that the patient has to understand what's happening with him, that he has to have the ability to think about it. He has to get the knowledge, and then you can discuss with him. You have to be in eyesight with the patient. And when you're in eyesight, then you have a partner, and you need that in such a sometimes disastrous situation, or you have to treat. You can a lot better treat patients if you if you have educated patients. Then they know where the way leads them, And then that's the first way to getting better. And what I keep always telling the patients is that tumor cells are actually really dumb cells. That the only thing they can do is reduplicate, like rabbits. But there was never seen in history, also in normal school medicine, that a tumor cell is actively attacking a healthy cell. Never. It's just overpopulation. And that's also when a person dies on cancer, it's a dying on overpopulation and cachexia, because that overpopulation is grabbing all the nutrients from the rest body. But never one cell attacks a healthy cell. So we are dealing not with intelligent cells, but with dumb cells. And if people realize that, they say, well, then I have the power. And I have the power, and I try to keep that power. And as long as my brain functions, I will try to keep that power in me. And those patients, I love those patients, because they come and tell me things which other people who are not educated enough would never do. Would never tell. Side effects. You can a lot more individualize the therapy. We have definitely a lot less side effects, even if we combine with conventional treatment, and we sometimes do here also chemotherapy, hypothermia with chemotherapy. We have not 10% of the side effects a normal clinic or even the big clinics have around here. So it's very important to understand the biology of a tumor. We have a mutation, we have mutants, but those mutants are the only thing they can do is reduplicate.